tattoo removal. But first, we're going to learn how to add water to the machine because it's pretty important. If there's no water, it'll still turn on. It'll look as though it's working, but then it doesn't. So after you apply the water, it has to recalibrate all over again, or warm up all over again. Just a little bit of water, add it in. You can kind of see it's like a shadow where the line is here. This is where the line is, and the water can go up to this area here. It's very subtle, but it's important that it's added. Just that little bit is all you really need. Now just ensure that the laser is going to turn on properly. Every once in a while you want to dust the slip off a little bit. You don't want to have any little dust bunnies in here and here. So I do that maybe once every few weeks. I just take a little wet paper towel and I just kind of clean it up. Okay. So the Picosure is definitely used just for the tattoo removal. 755 and a 532. And it also is used for rejuvenation with the focus lens. So first we're going to talk about the tattoo removal. So this is the handpiece for tattoo removal. It goes up to 2.0 millimeter to all the way to 6.0. And in order to start calibrating, you follow the screen. So you're going to turn this area in the center here. It'll give you a little check. Good, and you'll do it the other way. So now the machine is actually ready to be calibrated and to start your tattoo removal. So typically, for tattoo removal, skin types 1, 2, and 3, you are going to start either at, you could do 4.0, you could do 3.5, or you can even start at 3.0. It's usually my go-to. Sometimes even 3.5, you can even start out with a boost of 2. And here is where you have the adjustable pressure. You can always go up to 4, but usually just 2 is fine for the first treatment. And remembering with the depth, the deeper, the larger the spot size. If I started at 6, the deeper the treatment will go. So depending on the color of the tattoo, the thickness of the tattoo, how dark it is, how many treatments they've had, it all depends on where you're going to start with the treatment. So usually if it's a typical dark black tattoo, green, navy, blue, I would probably start at 4.0 and even go with maybe possibly, depending on how light their skin is, I maybe even would push it to a boost of 2 to add more pressure. Going forward, you can either keep it at this level, you can adjust it as long as you can see, depending on where the ink is in the dermis. So if it looks as though the ink is pretty shallow, I would keep it at I would go to 3.5 and keep it at maybe a boost of 2, or even move it to 3 or 4. If it looks really deep, almost looks like it is like a bruise, like where the ink looks really deep into the skin, you can even move it up to 5 or 6. You can even use the other hand piece, 8 or 10 if you really want to go deep. Usually after the treatment, after you would perform the treatment, the skin will look frosted. You're going to cover it up with Aquaphor, and you're going to cover it up with Saran Wrap, and then after that, they're free to go. It usually takes about 2 weeks. You're going to give them the aftercare sheet, and they're off. Usually the treatments are every 12 weeks. Oh,
can you talk about the consideration of time between treatments?
Yes, 12 weeks in between, just to ensure that the skin is healed and the body is able to move the ink through the lymphatic system and clear it out. So usually after about 12 weeks is where I see a really good amount of breakup in the skin, and then they're ready to have another treatment. Anytime earlier than that, it just doesn't really allow the body to really process that ink, and it can actually cause maybe some scarring or some discoloration. So the longer you wait in between treatments, the better it is.
Also, the body continues to remove the ink.
Yes.
So to save the patient some money,
Yes.
you communicate it, and if this is their main goal, and the money is a major consideration, the longer you wait, the less you pay.
Yes.
So keep this in mind as another attribute in the making decision how often to have the treatment.
Some people can only afford once a year, and I actually have seen really, really good results even with once a year treatments. So it just depends on how quickly you want it. It's not a quick treatment to have done. People will say they want to have it off by the summer, and it's maybe 2 summers from now, but not really. It takes a good solid 6 to 8 treatments, 12 weeks apart for most typical tattoos.
Talk about it.
Okay. So when people come in for tattoos that have 5 red, green, yellow, pink, purple along that little color scheme, we typically use a 532. It's really just focusing on those colors, not black, red, or green. So in order to calibrate this laser, it's a little bit more time consuming. It's a little bit of a process here. So we're going to take this one out. A little tug.
Do it slowly, please.
Okay. So you're going to see the red dot here and a red dot here. You insert it. Give it a little twist. It's going to come up as a warning. It just tells you how many to wear your eyewear is required. And so in the lenses here, there's only 2 goggles for 532. So you do have to make sure that you're wearing the appropriate goggles for this. Press OK. So the second piece that you're going to apply or put on is this. This is how it's calibrated. So you take this out, you put this on. So you see the 3 metal little prongs there, you match them up. And you're going to press the yellow. And retry it. Hold on, let's see what's going on. There we go. So now it's just adjusting the energy for the 532. And once that is adjusted, you're going to be able to just start the treatment. So you have 2 pieces. One is for the 2 millimeter and one is 1.5 millimeter. I think this treatment is very, very intense. It's way more intense than the 755. I usually just stick to the 2.0. It'll definitely be frosting. They definitely are red, swelling, a lot of swelling after this one. And I wouldn't be surprised if they have some blisters, even more so than the 755. Usually, typically with the blisters can last with the 755 is maybe after the first 1 or 2 treatments. But usually I feel the 532 is definitely stronger, and they can get blistering for 3 to 5 treatments afterwards on their 5th treatment. So now this is ready to go. Once it turns green, you can ready to start lasering. So the jewels always stay the same. The hertz you can adjust, but I kind of like to go a little fast, so I usually keep it on 10. And this is a 2.0 millimeter. So it's just standard. You can't really adjust too much on this. And then you're ready to go. Same applies for aftercare. Aquaphor, you're going to keep it wrapped out of the sun. Come back in 12 weeks, I would say, or longer if you wanted to. Other than that, you're good to go. 12 weeks, I'll see you. Good?
Yeah.
So now we have our laser in ready mode. I'm going to just demonstrate on how we use it. It's a very, very small spot size. 532 goggles on, so you always make sure it has a 532. The other 2 goggles are not meant for 532, they're just 755 and a 1064. So we have our foot pedal. You only need to really go over 1 pass. You want to keep it nice and tight. Slow. Just keep it it moving. You can see how it leaves a little bit of a frosting there. But with the ink you can really see it. But you want to keep it really tight because it's a very, very small spot size. You don't need to go too fast. It definitely takes a lot longer, more time to perform this treatment, especially if you have a really, really big tattoo. So just be aware that when you have a tattoo that is a red or green or yellow and it's pretty large, it's going to take you some time to get that finished. So it'll swell up, it'll turn, see it's already frosted, swelling. You're going to put some Aquaphor, you're going to cover it up, and then that patient will be back in 12 weeks for the next treatment. After that, I usually take this apart and I go back to my main piece. Actually, though, we're going to go to the focus as our next treatment, so let's do the focus. Okay. So focus is for rejuvenation. I'm going to use this. It comes in a 6, 8, or 10 millimeter. 6 meaning 1 through 3 skin types. 8 skin type 4, 5, and 10 is usually 6. So in my case, I'm going to use the 6 just to demonstrate. These are, if you were using it in this setting for an 8 millimeter for a tattoo, you wouldn't use the focus. You would use it just as a spot size. So this works as an 8 millimeter for a tattoo if you wanted to do this for tattoo removal. You can also use the same piece for an 8, even 10 without focus, and 6 if you wanted to, for acne scars. So depending on what you're using it for, these two pieces do a really good job for acne scars without the focus, and then they also use it for rejuvenation with the focus. So right now we're going to demonstrate with the focus. The focus lens does a great job for rejuvenation, fine lines, stimulating the elastin in the skin. Even for skin types 4 and 5, they do a good job with the sunspots. Even for skin type 6, it does a really good job for all of those ailments that people have here. So we're going to go back to our little spot here, and we're going to insert again. It has the red dot, so you always know how to put it in. Kind of gives you that there, a little marking. Put it in. This dot has to be not blinking. When you press OK, it just says your eyewear always. And this one is a 755, so any of the lenses here are going to work. So it gives you a count. So I have 26, 27 count. Each of these focuses comes with a 40,000 pulses. Typically for a face, you're going to start at 3,500 to anywhere up to 6,000 pulses per face, and a little bit more if you add in the neck. So I have 8 millimeter here. I'm going to press the go. It'll turn green. It's going to adjust. The important thing with this and all of the pieces is that you want to keep it perpendicular to the skin. You want to always see that circle stay a circle. You don't want to see this. You don't want it to go like this. You don't want it to go like this. Just perpendicular, and the metal tip always flush but not pushing in. That's too hard. You just kind of want to glide it through. It just kind of gives you a little barrier or a little focus of where you're going, just to kind of stay flush with the skin. Okay. So now we're ready to go. We have the red dot. It's on green. We have our 2,600 pulses left. Have our foot pedal, and here we go. So you can see how it's perfectly flush and how it's perpendicular. And you just kind of want to go a little bit on a little pattern here. And your pattern should be a little basket weave. And then you're going to start to see some erythema, a little swelling. So you see how it's always flush. It's a little pink, not too much. You don't want to have it like this. You don't want to have it where you don't hear anything. It's too far away. So you hear that snapping, and you see the red light is always a perfect circle. So that's how you know you're doing a really good treatment. You don't want to go too slow, and you don't want to go too fast. You start losing your grip there. So you just want to keep it where it's perfectly just a good, quick pattern, even. And that's good for the rejuvenation here. Now they'll feel, after it's finished, they'll feel that the skin feels as though it's sunburned, it's red, it burns. You can just you can put some ice on it if you feel though. It will stop in about 30 minutes. They can make sure they apply sunblock. They are going to apply moisturizer if they need to. Nothing really exclusive. They just need, just a nice, good moisturizer. For the next few days, if they have any brown spots, they'll turn brown. Their skin really will stay pink for about 24 hours, even less, even after only a couple hours. Then after that, they're going to feel like they had nothing done, which is good. And you usually do about a series of 4. You could do it 2 to 4 weeks apart, or you can even spread it out to 6 weeks, depending on the cost and their time. But this treatment really has no downtime. You can see I'm just pink with nothing much. And that's about the extent of that. In about 6 months after the last treatment is where you'll see the benefit of the treatment. You'll have less fine lines, less sun damage, more stimulated elastin, and better looking skin. And then after that, you could probably do it as much as you wanted to, depending on the quality of their skin. You could do it every year, you could do it every 6 months, or if you want to be really good and make Baruch happy, you'll do it every 2 weeks. And any questions?
Show me each of the elements in the screen.
Yes. Okay. So this demonstrates the joules for the treatment. It changes when you adjust the millimeters. So this is 8 millimeter. This is the hertz. So if somebody wanted to go a little bit slower on the hertz, you would press this down to 5. So it just definitely takes it down. I'm going to demonstrate that. You'll hear it, how much slower it is on the 10 is much faster, but if you're just starting out or you're doing a small little area or it's closer to the eye or something where you just want to be a little bit slower and more cautious, see how much slower it goes. So this way definitely is more uncomfortable for the patient, but for you, if you were doing it around the eye area and you wanted to just take your time, this is how it would go. I normally wouldn't take it down past, it only goes to 5, or does it go any lower? No, wait, I think it does go lower. Hold on. So it goes to 5, but that one is super slow, and I probably have never used this before. But let's just see for fun what it's like. 2.5. I don't know when you would ever use 2.5. I think 5 would be the slowest I would ever go. So that's pretty slow. I guess if you just had one spot and you want to be super, super precise, I guess you would use that. Okay, so this is where you have your pulses. Your pulse count is here, and this is the remaining pulses. So if I was going to start a brand new treatment, I would say, okay, I just used 984 on Marina's hand. I'm going to do another patient. I'm going to start all over. So then that would take you back to 0, but this is the remaining pulses of 1913. This is the pressure. So I would use this to adjust the pressure for tattoo. So when I have the original 755 on, the Pico 755 here for the tattoo, I would adjust the pressure. So you can go 1, 2, 3, or 4. And that's just adding more pressure, but it also changes the joules. So this is the original for 8 millimeter. If I was going to change it to a pressure of 1 adjusted, it would change the joules. So it just keeps changing it until it gets to the final, which is 4. I don't usually use the adjustable pressure for the focus. Not necessary. Any questions?
Nope.
Okay. We're good.
Yes.
Okay.
What to be careful about the arm, not to break it.
Yes. some estheticians have a problem with breaking pieces. The arm, the glasses. They go home with the glasses. No, I'm just kidding. So yes, this is very delicate. Actually, it's one of the. It's very actually awkward to use it. It takes a little practice. This see, it just kind of hangs there, so it doesn't. You have to kind of pull it in order. So sometimes I use 2 hands when I'm using it on a face because it makes this part easier to use if I have a little bit of pressure on this. But if not, you don't have enough. It's not as accurate when you're just using it like this. If you're moving it around, so you have to kind of have really good control of this. So it's tricky. It's a talent. It's a talent to use.
Now let me just point out.
Yes.
This part is used to be breaking very easily. I think that they kind of changed it.
They fixed it.
They fixed it. Right now there is some support, and
you also want to make sure these wires don't get too tangled. Because over here, if you see, if you tangle it too much, this part here will pull out. The whole machine kind of stops. You can't do anything. It'll say the handpiece is apart. It's not found. This happens every once in a while when this gets people will wrap this up too much and it kind of pulls out. So you just have to really be careful. You don't really want to cause that because it'll just take the treatment a little bit longer.
And also here, there is this lock here that lets you change the angle of the arm. You have to be very careful first, not to make sure that the arm doesn't drop, but don't try to move this in this direction without taking the pin out. Otherwise, you're going to break the pin. The pin already broke once.
I swear it wasn't me. Okay.